Hello, everyone, and thank you for joining today's educational webinar with Cancer Support Community Los Angeles. I'm Kathy Riley, the Associate Director of Programs at CSCLA, and I'm honored to welcome you to this week's webinar titled To Take or Not to Take Dietary Supplements. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. And our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, please visit our website at cancersupportla.org. And before I introduce today's wonderful speaker, please note that your video and microphone are automatically disabled for this webinar. You may, however, enter your questions into that Q&A feature that's found at the bottom of the Zoom window at any time. Questions will be answered at the end of the presentation, but we encourage you to enter them throughout this webinar. We may not be able to get to all your questions today, but we'll get to as many as possible. So I'll introduce today's speaker now. Urooj Riaz is a registered dietitian with 4 years experience in both inpatient and outpatient nutrition. She graduated from the University of Illinois at Chicago with a bachelor's in nutrition science. Her interest in nutrition developed to help prevent chronic diseases through food and nutrition. She has extensive clinical experience in oncology, weight management, bariatric surgery, diabetes, and gastrointestinal diseases. When not working, Urooj can be found watching a new season or crime docuseries, taking a stroll by the beach, or traveling. And it gives me great pleasure to welcome today's speaker, Urooj Riaz.
Hi, Kathy. Thank you for that introduction.
Yeah, thank you.
There we go. All right. Hello, everyone. Again, my name is Urooj Riaz, and I'm a dietitian at Providence St. John's Health Center. And this is one of the hot topics we often get asked about, like, should I take the supplement? Is it going to help with such and such thing? Or what's this associated with cancer prevention or not? So I thought it would be a nice topic to bring it together. There are a lot of supplements out there, but I'm going to highlight the common ones and their purposes and discuss its efficacy in cancer prevention, treatment, or management, and also look at if there's any risk associated with these individual supplements. Okay, so before we get into that, I just wanted to highlight like some of the common reasons people take the dietary supplements for. And oftentimes it's like just for general wellness, disease prevention, right? It's also to like boost the immune function or improve the energy. And some people take it for, just to bring the whole mind, body, person together. And oftentimes it's also for like improving their memory and concentration. And then there are differences when it comes to supplements. There is a dietary supplement, and then there is herbal supplements. So dietary one is more common, is more regulated too. Think about like vitamins and minerals and such. And it typically comes in like a tablet form, capsule, or powder liquid form. And it's to supplement the diet, right? Oftentimes it's like an enzyme or something. And they are also labeled as dietary supplements. And on the other side, there's herbal supplement, which is coming from a plant source or algae or fungi or combination of these. Oftentimes you see them in like a tea form, right? People are drinking the teas, herbal teas. It could also be in a tablet, capsule, powder, or any other form as well. And the purposes of today's presentation is to highlight a little bit of both, but more so the herbal supplements. That's one thing that we often get questions on. I wanted to bring this image right here. It's a little outdated, and I didn't see any newer stats on there, but these are the common supplements people use in their household. Fish oil for omega-3 fatty acids to get the anti-inflammatory properties too. That's the most common one being used. Glucosamine, probiotics are the hot ones too. Melatonin, and then the list goes on with like garlic supplements, ginseng, ginkgo biloba. So I might mention a couple of these, but not all of them. So the other thing that comes with it is like, how safe is it to take these supplements? So under the NIH, they have this program called NTP, or National Toxicology Program, and it conducts multiple studies to identify its harm, whether it's short-term or harm or long-term. And these are the different agencies like USDA, NIH, or public. They use these data to make different recommendations. These are some of the ongoing NTP studies. This one has been a new one coming up with cohosh for like the menstrual or menopausal symptoms. It helps with like hot flashes and such things. So that's like what's proposed. But they're trying to like find if it's actually effective or not. And then there are like the other ones too. These are the ones that the studies have been completed. So there is some data and I can like refer back to it. However, just keep in mind, a lot of these data studies have been done in vitro, meaning on animal and not on human. So sometimes we're lagging some data and you might hear me repeating myself saying, we need more studies. So something hasn't been done on humans yet. But we have some data and we can go from there. And if you have like specific questions, or curiosity about a specific supplement, it's always best to like reach out to your provider, your nurse, your dietitian, your doctor, especially if you're undergoing different types of treatments for cancer. These are the common ones that I am going to highlight, and we will go through them one by one. And then again, just to highlight why take the dietary supplement, it's to like improve the overall quality of life, right? And if you are getting like different types of treatments, you want to lessen its effect or its side effects. And it's just to like promote to control the cancer. Again, a lot of practitioners recommend like not to start taking any of these supplements while undergoing treatment, or if you are taking something, stop, or just let them know that you are on these type of supplements as a good practice. So again, the focus of this presentation is to highlight the relevancy in different cancers, whether the dietary supplements are effective with or any cancer activity, and the role it could play. And then just as a little background about myself, I do work with a lot of breast cancer patients too in the hospital, but I wanted to keep this conversation general, and I wanted to bring like all other cancers forward too and highlight those and its efficacy there too. But if you see me just pointing a lot often at breast cancer, I apologize for that in advance. Okay. So let's begin with green tea. In green tea, this is the specific polyphenol or the antioxidant. I cannot pronounce it, but it's EGCG that has sort of like anti-cancer actions. And it also could potentially help with other conditions too, like cholesterol, cardiovascular disease, and such. So basically, it works what we have seen in studies is that it works differently in different types of cancer. So for example, the first one, this EGCG, it helps inhibits the DNA replication in leukemia cancer cells. It also has the chemopreventive properties. It can also inhibit enzymes that are involved in cell replication or DNA synthesis. Some people would also put it like topically to reduce the radiation-related dermatitis. Some people take it orally to like help with the esophagitis that you can have specifically in the lung cancer. We didn't find it to be useful in the ovarian cancer. However, if somebody is drinking green tea, it does not increases the risk of ovarian cancer. It could maybe potentially be preventative too. And then in multiple studies, the consumption of green tea was associated with 15 to 17% reduced risk of developing breast cancer and recurrences. The EG/CG supplementation did not reduce the likelihood of prostate cancer, but it did lower the levels of PSA. And there, again, there's like mixed data on gastric and esophageal cancer. So the bottom line is, when it comes to green tea, is that it doesn't really have like side effects, and it's coming from a plant-based source for the most, like it's a plant, right? Green tea, even matcha. And it is okay to drink it multiple times a day if you're drinking in a tea form. Again, it could be preventing, if not cancer, it could be helping with other conditions and diseases too. The next one is flax seeds. So the flaxseed helps with the inhibition of angiogenesis, meaning it helps to prevent formation of new blood vessels. It also has a bigger role in the breast cancer with estrogen-related, specifically this compound called lignin. But overall, it has omega-3 fatty acids in them. It's a good source of a fat, and it plays an anti-inflammatory role. So flaxseed is used to help prevent breast cancer, prostate cancer, colon cancer. Also plays a good role with your blood sugars too. It helps lower the cholesterol, manages some of the symptoms of menopause, like having hot flashes or night sweats and such. And because it's like a source of a fiber too, it helps treat constipation. I'm gonna sort of like highlight, so specifically with this supplement, I'm gonna highlight and talk about the breast cancer specifically. Flaxseed has a phytoestrogenic effect, meaning it's both estrogenic and anti-estrogenic. And people do ask about, oh, is it safe for me to take it, especially if they're like estrogen positive breast cancer? Yes, it is safe to take it. It's a food source, right? It's nothing additional that we're adding. If you want to take it as a food source, it's fine. So what we've seen is it's effective in reducing the chances of breast cancer, those who have already been taking it, right? In a food form, like adding it to some type of foods or not. And I'll make some suggestions too. And what we also found was that it's less aggressive, or if somebody is it does develop a breast cancer, it's a less aggressive form of breast cancer. It can induce apoptosis, meaning programmed cell death. And then in some cells in animal studies have shown that this two specific phytoestrogen found in lignin, named electrolactone and estradiol, I hope I'm saying right, may suppress the breast tumor growth. So the bottom line when it comes to flaxseed is take it in a food form, not supplementation. You can take like 1 to 2 tablespoons in like a yogurt or cereal or something. Typically this is something that I do, again, just to like get like good benefits from it, like omega-3 fatty acids, obviously. I would take like 1 to 2 tablespoons. You want to go with the ground form of the flax seeds. It's better tolerated, and you absorb more of its good properties. So you take like 1 to 2 tablespoons or up to 3 tablespoons. You can add it to like a little bit, like a half a glass of water, and you can just take like a quick 2 shots of that, and then drink more water to clean out your palate. That's one way of taking it, so that you don't have to be eating it if you're not a fan of flaxseed specifically. But otherwise, if you do like it, you can add it to water, yogurt, other cereals and such, and I think it blends very well with those items too. Okay, the next one is turmeric, or the specific compound or the antioxidant in turmeric is called curcumin. It can help reduce many cancers as well as infection and inflammation. A little anecdote I will share about turmeric is that when I was younger, right, growing up, I used to get like pimples or something, and my mom would like make a paste with the turmeric, and she would ask me to like just put it on my skin, like wherever I will break out, she would put it on there. What I noticed was like it helped, like personally speaking, it helped with the faster recovery of the pimple. So a lot of times, like what we will see in studies is that it helps with like the dermatitis too. You can put it might burn a little bit, sting a little bit, but that's just something personal too. But I'll talk about what the science say about it. There's no common dosage. Just remember, it is a spice. So if you're adding it already to your food sources, keep doing so. You're probably getting some benefits from there. Oftentimes, if it comes in a supplement form or like a pill form, it's recommended to take it with the black pepper. It helps bring out more of its properties too. And then in the lab studies on rat, the studies strongly suggest that turmeric may be able to reduce the growth of cancer cells. Again, it's to prevent cancer, infection, reduce inflammation. It's also to help treat the joint pain. And I've had some of my patients start taking turmeric because it's an anti-inflammatory, and they notice that it helped with their joint pains too. Oftentimes, if it's the chemotherapy or something is causing joint pains, you can consider taking it in your food sources specifically. So again, topically speaking, going back to like, it just like sort of like when I was doing the research, it jot that memory back from Beck to help reduce like the dermatitis sort of thing. So topically speaking, it reduces the radiotherapy-induced dermatitis in patients with head and neck cancer and breast cancer. Orally speaking, when it was given to the colorectal patients during the surgery, it improved their overall cachexia. So cachexia is like when the body's under stress like cancer, and they lose a lot of weight or lose a lot of muscle mass, they become cachectic. So it can help, it's shown to help prevent that. And then in one study, when they blend the turmeric with green tea, pomegranate, broccoli, it helped resulted in the reduction rate of the PSA, so specifically with the prostate cancer. And then when it was combined with this hydroxytyrosol, it's an antioxidant found in olive oil and red wine, in addition with omega-3 fatty acids, like for example, olive oil, or obviously omega-3 fatty acids found in olive oil, but other sources too, or curcumin, it helped reduce the inflammation and pain in early breast cancer patients with aromatase induced musculoskeletal symptoms. So it was helping with this type of symptom too. In the GI tract, it did not prevent lower intestinal tract adenoma, especially people who already had familial adenomas. So the bottom line is there's no recommended dosage. It is a spice, like I mentioned. You can add like a small amounts, like a pinch to, or follow the recipe. Like you can use it in like different soups. You can add it to different teas. You can make curries with it, right? Or you can follow a recipe. So stick with that. So you don't have like GI symptoms or GI upset. It may help lessen the effect of the certain chemotherapies. So if you're not already taking a supplement, don't take it, but you can take it as a part of the food. All right, the next one is called the ginkgo biloba. It has more to do with the function and memory. So a lot of time when patients are getting chemotherapy, they often mention, I have brain fog. Right, so this was like a larger study done by the NTP because of its widespread use, but they also wanted to the purpose of the study was to determine the toxicity and the carcinogenicity. And then after the 2-year study in mice, again, it's mice, it's not humans yet, it was found to increase an increase in liver cancer in males and female mice, and in cancer of the thyroid gland in male and female. So again, in human, it was found to improve the overall memory. However, the studies are limited, or we don't know much information when it comes to cancer and cancer prevention, right? But this larger study, GEM, they do not support the use of ginkgo to reduce the cancer. And it was also ineffective in preventing chemotherapy-associated cognitive dysfunction in breast cancer specifically. It may reduce the overall or reduce the ovarian cancer risk. And then animal models suggest that high doses may have hepatocarcinogenic effects on your body. So you don't want to take it in high amounts either. Okay, so again, I don't know what the recommended allowance are. You can take it if you're concerned about your memory, but don't take it if you're trying to like take it for chemo-related cognitive dysfunction. The next one is aloe vera. And if you have an aloe vera plant at home, great. You just need the inside the gel part of it. It has more of like a healing, wound healing. It's anti-inflammatory, it's antifungal. So you can consider like putting it on like burns or such. It may help against both radiation-induced mucositis too. They also make like aloe vera gel mouthwashes. You can do like rinse, swish, and spit. You want to be careful not to use the leaf part of the aloe vera, but it could be used as like a laxative. However, it's not recommended by the LDA to be taken for laxative purposes, the leaf part of it. The gel is okay, gel is like different purposes. And when it comes to like breast cancer specifically, the research shows no benefit orally or topically speaking, but again, if you have a burn or something from radiation, it can help with the wound healing or soothe your skin a bit. Just remember, like, not to confuse it with the gel versus the juice. It's very different, right? We're talking about the gel. And then again, like I mentioned, FDA rules that aloe vera is not safe as a stimulant laxative. And then it helps inhibit the emollient from the aloe inhibited cell proliferation and induce apoptosis in human liver cancer cell lines and enhance the effects of radiation treatments. The next one is astragalus. And this one is plays a role with your immune function and your liver health. You can also increase the stamina. So these are the purposes or the perpetrated uses that people take it for, and it can also reduce the cancer-related fatigue. However, when people do take it, the possible side effects are feeling more fatigue and having a headache and low blood pressure. So if you're taking any drug that suppresses your immune system, chemotherapy, for example, do not take this. It's not recommended to take this supplement. But you can take it if you were like sort of like a healthy person, you can consider it. Again, just talk with us what the reason you want to use it for. So again, in the preclinical studies, small studies have been done for fatigue for cancer patients. We still need like larger studies. We don't know much about it. Some anti-cancer effects against gastric, colon, hepatic, and ovarian cancer cells. However, limited data, and we need more studies. The next one is a melatonin, and it's a hormone, right? It's a supplement, it's a dietary supplement, not an herbal supplement. Melatonin plays a role with the sleep cycle, right? And it's also claimed as an antioxidant that reduces cell damage and boosts the immune system. And general idea is like somebody who's getting better sleep, they tend to be less stressed too. If you're not getting enough sleep, your risk of you tend to be high stressed. The stress in itself is not good for our body. We have seen that stress can cause different types of cancers too. So the use caution, you can consider taking it if you're not getting enough sleep, but if you are on certain types of blood thinners or you're taking medications to treat diabetes, seizures, or may affect the reproductive hormone levels in women. So just bring it up to your doctor and see what they have to say about it, or bring it up to us. Your body produces it endogenously too. So right, this is the hormone that we make it, so that it plays a role with our sleep cycle. And it is also found produces it endogenously, right? Yes, sorry. And you can also get it from the food sources, like some fruits have it, nuts have it, olive oil have it, wine, some red wine or wine also have it. Overall, so lower levels of melatonin is like those who get less sleep. So less sleep you have, you're going to have less melatonin, and then higher risk of developing breast cancer. In studies of postmenopausal breast cancer survivors, short-term supplementation did not influence their estradiol levels, but improved their sleep quality. And then in the lab, melatonin appears to slow the growth of the breast cancer cells. However, it was unclear if melatonin supplements can help prevent or even treat the breast cancer. And we did not find any, I know I've highlighted a lot about the breast cancer, but again, I did not find any relevancy with other cancers. The next one is milk thistle seed. This plays a role with your liver function, right? A lot of time chemotherapies can be toxic, or it can raise your liver function tests. So it's used as a herbal supplement for liver diseases and for alcoholic liver diseases. Its thought is it reduces the changes in the liver function caused by chemotherapy. And some also take it to reduce the risk of cancer. The risk associated with the milk thistle is that it can interact with different chemotherapy drugs. So again, let your doctor know if you are taking this or if you plan on taking it. If you aren't already taking it, do not start taking this supplement. extracts from parts of the plant other than the seeds may increase estrogen levels in the body. Okay. These are the milk thistle. Again, it's used for cancer prevention, cirrhosis, drug-induced hepatotoxicity, hepatitis, and liver diseases. It may reduce, like I mentioned, chemotherapy-induced hepatotoxicity in children with acute lymphoblastic leukemia, and especially if they have taken this type of therapy, cisplatin-induced nephrotoxicity. In lab, research suggests milk thistle may reduce the growth of cancer cells, but again, we don't have any research done on human. The next one is the turkey tail. This one is a very common one. A lot of people ask us questions about this. It plays a role also with immune system or boosting your immune system. Not studied thoroughly in human, right? Side effects, we don't know the side effects of it. In labs, in mice, it's shown to have increase in immune response with bone marrow cells and reduction in toxic effect. Data is mixed on breast cancer, hepatocellular carcinoma, and leukemia. In conjunction with the chemotherapy, suggests benefits in patients with advanced non-small cell lung cancer. There are generally this compound or these extracts are generally well tolerated, but some people might experience some minor adverse side effects. The next one is vitamin D. Vitamin D helps the body absorb the calcium in the bones, and that's the purpose. It's important for menopausal women and women taking aromatase inhibitor to treat breast cancer. And also a lot of time, the aromatase inhibitor results into bone loss, bone density loss. So a lot of people you will see are in combination are on vitamin D and calcium. And then for many years, studies have shown that people who are less exposed to sunlight and have a lower level of vitamin D as a result are more likely to develop breast cancer and other forms of cancer too. So it's a good idea to, when you do your annual physical exam, have your doctor check your vitamin D levels too. And more recently, calcium and vitamin D may help protect premenopausal women against breast cancer, but we need more studies. That's a suggested. Talking about other cancers too, data reveal that vitamin D deficiency is highly prevalent in advanced pancreatic cancer and colorectal cancers. So again, getting your vitamin D checked early can help, right? And you can start taking the supplements too. It helps. The data on the benefits to reduce skin cancer cells and advanced cancer are missed. We don't know much information about that. It's not been protective against non-Hodgkin lymphoma, ovarian, kidney, endometrial, esophageal, and gastric cancers. And the data from the meta-analysis are conflicting on whether vitamin D supplementation can reduce the cancer incidence or mortality. So the bottom line is the RDA, or the recommended daily allowance for vitamin D, is 600 IUs. And then most people, if the upper level is 4,000, if you are deficient in vitamin D, you need a higher level. Typically speaking, the doctors will suggest taking 2,000 to 4,000 IUs. If you're deficient, if you're super low, you might need even a higher dose for it. The sun is a source of vitamin D, but you don't want to be out in the sun for long term. So you can try to get small amounts of vitamin D from these food sources, fatty fishes like salmon or tuna, fish liver oil, or eggs, yolk, or fortified milks and cereals. I believe this is the last supplement that I wanted to highlight, glutamine. Glutamine is a chemical that your body makes to build protein too. And the common food sources are wheat, corn, barley, peanut, soybeans, egg whites, and milk. You can also get it from the supplement form if you need a higher amounts for different purposes. A lot of people take it to treat weakness and loss of muscle mass that can be caused by cancer treatments. A lot of my patients are on glutamine, or they take glutamine for like neuropathy, especially caused by chemotherapy, and a lot of them do see some improvement. Not very common, but it can also be used to treat nausea, vomiting, diarrhea that can be caused by cancer treatment. and it can help with the recovery after surgery by reducing your risk of infection. Okay, again, it's used for the peripheral neuropathy. The short-term use of glutamine for adverse toxicity for chemotherapy and radiation is safe. However, the long-term use of high doses of glutamine during active cancer is contraindicated. So just have a discussion with the doctor. And then how glutamine affect cancer growth remains unknown. It could be useful again against the cachexia neuropathy, right? Again, we need more studies. Some meta-analysis report lack of strong evidence for glutamine for oral mucositis and for radiation-associated gastrointestinal toxicity. So I'm just like sort of like bringing out different studies that have been done. What was the bottom line? What they found? What they studied? And so that you are more well versed about it and different kinds of cancers. But at the same time, if you have like specific concerns, it's best to like bring it up to someone's attention, a practitioner's attention. With that, so I obviously I don't have a lot of time to like highlight a lot of different types of supplements, but there are many and different people take it for different reasons. So there is this application, if you want to go ahead and download this, it's called Herb List, and it goes through like a list of different ones, and you can learn more about it. It's coming from NIH, so it's sort of like backed up too, and you know it's coming from a reputable source. And then the other resource that I often use is coming from the Memorial Sloan Kettering Cancer Center. So if I don't know about a certain dietary supplements or such or herbal supplements, I often go on these websites. Again, it's reputable. They have done their research if there is any research done on them. And it's a good way to like get some background and information on there so that our participants can make like the best judgment whether to use it or not, and then let us know too, especially if you're undergoing any type of treatments. And then with that, I would end my presentation. Hopefully you found it beneficial, and I will open it up to questions.
Oh, what a wonderful presentation. I learned so much. I've heard you present before, but I feel like I'm learning new things all the time. So thank you so much for that meaningful and informative presentation. We now welcome questions from all of you. We have received some in the Q&A, so I'll begin with those. And if you have a question that wasn't answered in the presentation, or you think of another one while we're asking these, we've got time for some questions. So feel free to enter them into the Q&A. Going back to your description of green tea and its benefits, someone is asking, is decaffeinated green tea also helpful?
Yes, absolutely. So the polyphenol that I talked about, the EGCG, it's part of the green tea. So whether you get it caffeinated or decaffeinated, you can do either or. Or some people do matcha, so you still get the effects of the green tea. Green tea is just like a powdered form of matcha, is a powdered form of green tea. So either or, caffeine, decaffeinated matcha is appropriate.
Great. And then for flax seeds, is taking it as an oil, either from a bottle or in capsules, effective?
Yeah, so basically when it comes to flaxseed, we're looking for the omega-3 fatty acids. So to have its anti-inflammatory properties. So yes, omega-3 is typically like comes in a form of, it's a fatty acid. So it is okay to take it as an oil form, or you can take it in the capsules too if you want to. But it's always my presentation, I did mention not to start taking the supplementation if you're already taking it and somebody's going undergoing treatments. It's best to take it in a food form, but if you want to take it, just bring it up. Otherwise, oils are okay. You can take it.
Great.
And it would be effective, yes. Should be.
And then we have a question about EGCG, which I am not going to attempt to say either. That was a hard one. Someone is taking it long term, and the doctor has prescribed it 3 years ago, and this individual is still taking it. So, what about, and this is probably a great question for all of us, what about taking this particular supplement long term? Is it safe? Is it something safe to take long term?
I would, yes, I would say so, because it's a polyphenol. What I would be a little I'm a little curious about the dosage that they're taking it in. So when it comes to green tea, you don't like, it's a green tea. It's already diluted with water and such. So I'm a little curious, like what the amount of EGCG that they're taking to. And I would be honest with you, I don't know. There wasn't no the studies didn't recommend what allowance or the dosage that you're allowed to take. So that would be something that I will look a little bit more into it, and I can get back to this person. I do have my email address in here if this person wants to reach out to me and email me, and I can do a little bit more research and I can get back to them. But in my, what I believe or what I think is that if you're taking it in a supplement form, the EGCG, I think it should be fine because it is a antioxidant.
That's great. Thank you. And I'm glad you brought up your email on this slide. And participants should feel free to email Urooj if you have a question that we're not able to answer at this time, or something that needs a little more exploration, like the previous question. Um, so now moving to melatonin, what is the recommended dosage and duration of melatonin?
Yeah, that's a good question. So you typically want to start small. The supplement form typically comes in 5 mg. That's on the bottle. You can start taking it with half. So you want to see how, start small and then you can increase it. I think the max amount is 5 mg. Some people can take it up to 10, but start small, start with like 2.5. You can break it into half if you want. And the duration is like, you want to take it before you go to sleep. Some people do become reliant on it. Obviously, you want to tackle the underlying causes too that's disrupting your sleep. So like, get to the root cause. If there's a stress, address that before you start taking these things. But for the time being, while you're managing your stress, it's okay to take it, but don't take it long term. Once your sleep is back to and it's being regulated, you're getting like good anywhere from like 7, typically 6 to 8 hours of sleep. That's a good amount of sleep where you're not relying on like, waking up with the alarm all the time. Like on the work days, obviously makes sense. But if you can get good 6 to 8 hours of sleep and you wake up feeling refreshed, that's a good sign that you have gotten enough sleep. But this is just to sort of like supplement your sleep. Don't take it long term, and then start small with like 2.5, and you can go up to 5 mg.
Okay, great advice. Thank you. And then I'm seeing another question that I have also.
Okay.
Are there some brands of supplements that are better than others? I mean, that's a great question that we all have. Supplements are so maybe you could talk a little bit about, are supplements regulated? Are they not regulated? And then what are there brands that are better than others?
That's a great question. And so when I'm talking about dietary supplements, right, those are things that are more regulated often by FDA, like minerals and vitamins and like even melatonin, for example. You want to look for, so every company does its own research. The quality of the supplement, so that it doesn't have a lot of like other minerals in it that could be harmful. You want to look on the packaging itself. You want to look for different labels. There's one label, NSF, I believe, NSF. So it helps with the quality assurance. The other one is called USP. So that also means that it's being also, yes, the brand is making it, but it's also being tested by somebody else to make sure the quality is up to par, basically. And after that, I don't have like specific brands, but if one of those things are listed there, it's fine. However, that's for dietary supplements, right? So we know we could be sure because those are studied by the government too. When it comes to herbal supplements, it's All is fair game. Anybody can make something and they can sell it. They can sell it at any dosage or so. We don't know the quality of it. We don't know where it's coming from. So the idea would be to just learn, do a little bit more research into the brand itself. There are so many out there that I cannot even like recommend any specific one. So it's a little like a gray area for that, for the herbal supplements. So if I were to like bring my presentation back, my recommendation is, I mentioned like turmeric, I mentioned green tea, I mentioned flax seeds. Those are all like, exception to green tea, those are all like food sources. If you can get your supplements that you're looking for, or the purposes or the benefits from the food sources, stick with the food sources for the most part. But again, if there is something you want in a supplement form, then research the company itself.
That's great help. Thank you so much. Moving on now to a different supplement. Can you talk a little bit about alpha lipoic? I don't know if I'm saying that correctly. Acid, yeah, for neuropathy.
So alpha lipoic acid is a dietary supplement. So yes, it does help with neuropathy. People also take it for like just immune function too. Take it. I would say again, like, let me know the amount you're taking. I don't know the dosage on it, but it could help some patients with neuropathy too.
And is there a recommended dosage for that?
I don't know on top of my hand, to be honest with you.
Okay. Thank you for that.
But again, I would say this person just email me and I can email them back.
Okay, perfect. And then someone's asking about resveratrol. I know there was, that was really, noted a while back, but currently, what's the thinking on resveratrol?
So resveratrol, not so much with cancer. I would say it is an antioxidant, don't get me wrong. Found in like grapes, red wine and such. You want to use moderate amounts when it comes to red wine. But it plays more of a role with like cardiovascular health. So it helps like not building up a lot of like cholesterol around your arteries. Not so much with cancer. But all in all types of antioxidant, different colors, different polyphenols does help with the cancer health.
Okay, great. And then can you talk more about the vitamin D dosage? And I know there was sort of a continuum there, sort of, kind of based on where you are. Could you talk a little more about that?
Absolutely. So vitamin D dosage, RDA, recommended daily allowance, is 600 IUs. And in common multivitamins, supplements too, that's what they put in there. Sometimes it's higher too. So typically somebody who has, if they have gotten their blood workup done and they are within the normal range for the vitamin D, they can just keep taking the RDA amount if they want, or they can get it from the food sources or going out in the sun. Sun is the best source. However, if they are deficient or low in vitamin D, meaning like less than 30 something, anywhere between like 20 to 30, then they can go take the up to 2,000 to 4,000 IUs per day. If somebody is super low, less than in like teens or in single digits for their vitamin D level lab, then you want to take even a higher amount. Like sometimes you have to take like 10,000 IUs per week or 50,000 IUs per week, something like that. So it varies, but on the safe end, it's 600 IUs. If you're deficient, it's anywhere from 2,000 to 4,000 IUs per day. And that is still safe amount. I hope that clears it up.
Yeah, great. Is sour soup, tea, or juice safe and effective?
Okay.
I said that wrong. Sour, how do you say it? Sour? Yeah.
I'll be honest, I don't think I've ever heard of that. Sour soup.
Okay.
I don't know if you're familiar with that or not, but I'm sorry, I don't know if I can answer this question. But something to email me so I can look more into and I can learn in the process too.
Fantastic. So there's a couple more questions about choosing quality supplements, and you gave us some. I think you said NSF and USP, and
Right.
it's
It's
approved
listed
by
on here.
those.
I wish I can share it here, but
Yeah, and then someone else is saying some supplements say clinically proven. Um, are these, again, it gets very confusing to us as consumers. Are these better choices than the more generic types, or should we go back to looking for those acronyms that you gave us?
yeah, I would say so. Again, this is a good question, and it's a marketing technique, right? Clinically proven by our product. So I would say when it comes to dietary supplement, go with those labels to find on the packaging itself. Don't fall for these clinically proven or our product works better than the other products. Those are all marketing techniques. You can go for more generic types.
Okay, great. And then can we take both vitamin D and calcium at the same time? Someone is asking.
Yes, absolutely.
Okay.
Easy answer.
Great. Uh, and then and I may not be saying this correctly either. I think it's coenzyme Q10.
I think it's coenzyme.
Yep, Q10
Coenzyme.
effective for preventing cancer.
I didn't not research this one for the studies purposes, but it may not be. I have to look more into it. I have to look into the research actually. But yes, this is a supplement. A lot of people are on it, not just for cancer, but they take it for other purposes too.
Okay,
Yeah, email me, please. I'll get
great,
back to you.
wonderful. And then, how long should you use zinc for wound healing?
Uh, Good question. It depends on the type of a wound too. Zinc also plays a role with immune health and wound healing. You know, your immune system and helping you with the wound healing. If it's a high dose of zinc, you don't want to be on it for long term, right? And by when I say high dose, it's like 200, I think it's 220 milligram per day. That is something that you take for about 2 weeks. And then you go back down to like a normal amount. And I do not remember on top of my head, but it's typically come with something else like zinc sulfate or something, 220 milligram. That you want to take for about 10 to 14 days, and then you stop taking it basically. The
Okay,
reason being is if you're taking a high amount of zinc, it inhibits the absorption of copper, which is also a mineral that we can get from food sources or supplements. So you don't want to interact with that. So daily, I think the recommended allowance for zinc, it's much lower. Zinc on its own, I think, what is it? I don't know why I'm thinking of 11, but I don't think it's 11. It's less than 220 for sure. Or is it 11 grams? I will have to get back to it, but don't take more than, if you're taking zinc sulfate, 220 milligram, do not take it for more than 10 to 14 days. Bottom line.
great. And then there are just a couple of additional questions that we got at registration that haven't been addressed here. So I'll ask those, and then we can finish up for the evening. You talked a lot about turmeric, and do you recommend taking it in a capsule form at all? I know you talked about it as a spice and using the pure form of it, but someone asked at registration, is it a good idea or bad idea to take turmeric in capsule form daily?
Right. Taking a turmeric in a supplement, it's okay. You can still take it. It's easier. It's already like sort of like capsulated in it, so you don't feel it spicy. It just goes in your stomach. You can take it in a supplement form too. However, if you're starting a new therapy, chemotherapy or such thing, don't start taking it. You can do it before or you can do it after. And one thing I would also mention, if you're looking at it in a supplement form, get it with something that also has black pepper. Black pepper helps with the absorption of the properties of turmeric, curcumin.
That's
Okay, so
great.
look for that.
Yeah, great advice. There also were a couple of questions at registration that dealt with gastrointestinal issues, related to treatment, even some, post-surgery, post-treatment. Any recommended, supplements, anything that aids in digestive health?
I supplement wise, it depends on what type of GI symptoms they're feeling. Is it constipation versus diarrhea, or upset stomach versus bloating or gas or something? So it varies, and the supplements do vary from their conditions. As a general rule of thumb is that as long as you're able to eat whole foods for the most part, um, fruits, vegetables, get healthy grains, think about the legumes. So they help with both constipation and diarrhea. And though constipation and diarrhea is a common one too. The other one, GI symptoms is also like nausea. That's something else too. Not a lot of supplements for that per se, but as long as you're able to get it from the food source, get it from the food sources. But the ones that I did mention, like flaxseed, if you're having a lot of like, it can help with constipation, and it can also help a little bit with the diarrhea too. For diarrhea, you want to go for more like chia seeds because it's more water absorbing. It's more viscous. So it's different. It varies from symptom to symptom. So I cannot answer in a broad term. It has to be more specific.
Great. Well, this is just a great way to bring our time together to a close, and I really want to thank you, Aruj, for your time
No,
today and for sharing your expertise with us. We had a lot of interest, lots of questions, and thank you for taking us on this journey of exploring supplements. We really
right.
appreciate
Like
it.
I said, this is a hot topic. We get questions, a lot of questions asked too.
Yes. And thank you to you, our attendees, for engaging with us today and for all of your thoughtful questions and your participation. Again, if you want to learn more about Cancer Support Community, you can go to our website. And also, if you would like to receive a copy of today's slides, email us at info@cancersupportla.org. Aruj has graciously offered to, not only did she share her email, but she's offered to share those slides to anybody who would like to review them. So again, that's info@cancersupportla.org. And then Abby, we have a final slide we were gonna put up from us. So our website is here, as well as that info email. And then we want to, if you're new to CSCLA, you can use this QR code to join us, to become a member. All of our programs are at no cost, and we have wonderful programming, such as this webinar. And then there are a couple of in-person healthy lifestyle classes. We invite you to join with us. Every Wednesday, we have an in-person Shakti Nam yoga class that includes some breath work, meditation, sound vibration, and it is for all ages and backgrounds and experience. So that's at our location on Wednesdays at 11:45. We're at 1990 South Bundy, Suite 100 in Los Angeles. If you want to come by on Wednesdays, you can register using the QR code below. And then also an in-person gentle yoga class that we have on Thursdays at 1:30. Well, everyone, thank you so much for joining us today. And thank you, Aruj. And we'll see everyone at a future webinar.